Ever pondered about HIV and its risks? Do you know the stages it progresses through and the symptoms it exhibits? Well, it's time to delve into this topic and learn more about it. HIV, or human immunodeficiency virus, is the culprit behind acquired immune deficiency syndrome, or AIDS. It wreaks havoc on the immune system by primarily eliminating CD4 plus T helper lymphocytes, leading to a progressive reduction in immunity. This diminished immunity paves the way for opportunistic infections and certain cancers. These infections are the handiwork of organisms that usually don't pose threats to healthy individuals. Moreover, HIV can directly damage organs like the brain. The progression from HIV infection to AIDS varies greatly. While it can be as quick as 6 months in rare cases, it can also span over 15 years. In places like the United Kingdom, the average time is around 12 years. HIV infection passes through several stages before culminating in AIDS. The first is the seroconversion illness, which occurs 1 to 6 weeks after infection, mimicking flu-like symptoms. Then comes the asymptomatic infection stage, where the virus levels are low and the individual experiences no symptoms. This stage can last for several years. Next is the persistent generalized lymphadenopathy stage, marked by swollen lymph nodes for 3 months or longer. This is followed by the symptomatic infection stage, where patients start showing symptoms and may contract opportunistic infections. This stage is a precursor to AIDS, referred to as the AIDS-related complex. Finally, we reach the AIDS stage, characterized by severe immunodeficiency, life-threatening infections, and unusual tumors. It's important to note that a small group of patients, known as non-progressors, develop AIDS very slowly or not at all. The symptoms of AIDS can include rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits or neck, diarrhea that lasts for more than a week, sores of the mouth, anus or genitals, and pneumonia. In terms of managing HIV, dietary supplements can play a crucial role. B-complex vitamins can help boost the immune and nervous systems, while vitamin C aids the body in fighting infection and responding to illness. Lean protein sources like skinless chicken, turkey, fish, egg whites, tofu, and beans are beneficial, especially when cooked using low-fat techniques like baking, broiling, or sautéing. Whole grain products should also be a focus. In summary, HIV is a destructive virus that progresses through several stages before developing into AIDS. The symptoms vary, but include weight loss, fever, tiredness, swollen lymph glands, and more. However, with a balanced diet and appropriate supplements, one can manage the condition and slow its progression. Remember, knowledge is power, and understanding HIV is the first